the coronavirus pandemic, and how a social media movement called caremongering is helping vulnerable people cope with the crisis wherever they are. Italy has reached another grim milestone, recording the highest death toll on a single day anywhere in the world. 919 people have died of the virus in just 24 hours on Friday. Infections are also on the rise, with
Donald Trump for facilitating the ship's deployment. He says the numbers of coronavirus cases and deaths will rise steeply over the next 3 weeks.
They're seeing surge numbers that put them on track within a week to be in line with where New York City currently is, if they see the kind of increases they experienced yesterday.
New York City is the country's hardest hit location. Doctors there say they don't have proper equipment to care for sick patients.
Every time that I leave from the ship, I'm just very frustrated because we are doing everything that we can to help everyone, to see everyone, to treat everyone, but we have limited resources and not as much support.
New York Governor Andrew Cuomo says the peak number of cases is still weeks away.
Now we're looking at about 21 days for a possible apex. So we want to do everything we can to be ready for that increased capacity that could hit us in 21 days. So I say, my friends, that we go out there today and we kick coronavirus ass. That's what I say.
The motion is adopted.
In Washington, Congress passed a $2 trillion emergency aid and relief bill.
This bill is the most consequential piece of legislation that many of us will ever vote on. The American people need help, and they need it now.
The bill gives bailouts to major corporations affected by the pandemic, extends unemployment benefits, and provides cash payments to families. President Trump quickly signed it into law.
This is going to save companies that are incredible companies, but that are going to need some help because of what happened. A month ago, they were outstanding. They were having the best year they ever had, and then we got hit. And so we'll help them out.
And ventilators and other critical medical supplies. We have
Trump
three
repeatedly
governors who are now
his
begging
coronavirus
President Trump
response.
to invoke this.
The federal government's done a hell of a
the governor of
job.
New York, Andrew Cuomo.
In spite of Trump's boasts, new hotspots are emerging in Chicago, Detroit, Dallas.
For more than a week. That's when the local airport will also reopen for domestic flights. China's health ministry says 54 imported cases were recorded in other parts of the mainland. Also reopened people have died in China after catching the virus. China's health ministry says 54 imported cases were recorded in other parts of the mainland. And in Hong Kong, public gatherings of more than 4 people have been banned after people have died in China after catching the virus. Health ministry in Hong Kong.
At this stage, we still have the current figures as of 54 new cases, 55 were on the previous day, so certainly a drop in one. And of course, all of these cases and the criticism or the concern now is the new battleground being the imported cases. The virus. Health ministry says 54 imported back into China. And as a result, the Chinese government has basically put in place a ban on foreign nationals.
And in Hong Kong, public gatherings of more than 4 people have been banned after people have died in China after catching the virus. Health ministry in Hong Kong.
Entrance or access. At this stage, we still have the current figures as of 54 new cases. And this is simply them trying to curb the spread now is the new battleground being imported. They will have one flight that can come into China as a result of this ban. This is simply them trying to curb the spread on the new battleground being imported. Restricting them one flight that can come into China as a result of this ban. This is simply them trying to curb the spread with the lockdown China as a result of this ban. This is simply them trying to curb the spread with the lockdown China as a result of this ban. This is simply them trying to They've got the trains. Subway lines. So certainly some subway lines. So certainly some traffic fines. Those considered in the green category are allowed to travel again.
In Japan, more than 50 new confirmed cases of infections have been reported in Tokyo. It is a record daily increase in the number of infections in that city. The governor's asked tens of millions of people of the capital and surrounding areas to avoid all non-essential travel until April 12th. Warning against complacency in the fight against coronavirus. Minister Chung for a long battle ahead
are allowed
as
to travel
146 new cases. In Japan, more than 50 new confirmed cases of infections have been reported. The total number of Tokyo. It is a record daily increase in the number of infections in that city. The governor's asked tens of millions of people of the capital and surrounding areas until avoid all non-essential travel until April 12th. A state of emergency warning against complacency in the fight against coronavirus. For a long battle as 146 new cases. In Japan, more than confirmed cases of infections have been reported in Tokyo. It is a record daily increase in the number of infections in that city. The governor's asked tens of millions of people in the capital and surrounding areas to avoid all non-essential travel until April 12th. For a state of emergency warning against complacency in the fight against travel for a long battle as 146 in the country. New York's new cases in Japan, more than 50 have been reported in Tokyo. The daily increase in the number of infections in that city. The governor's asked tens of millions of people in the capital and surrounding areas to avoid all non-essential travel until April 12th. For a state of emergency warning against complacency in the fight against travel coronavirus.
They're sick and in urgent need of a doctor. But with the emergency room hospital inundated with coronavirus patients and no available beds, they arrive early in the morning to wait in line to try to get seen. Inside Elmhurst Hospital, medical staff struggle to keep people alive. In one 24-hour period, 13 people died from COVID-19. The hospital has 500 beds and is over capacity.
All the patients in this room, all the feet that you see, they all have COVID.
A nurse shared video with the New York Times, a glimpse of what it's like inside. Another doctor, speaking anonymously, described the situation like this. It's just like a tidal wave. The only beds we have been able to free up are people who have died. It's a pretty dire situation. COVID is completely taking over the hospital.
They need help. And they need help in a real way. I've talked to a lot of friends of mine who are working there, multiple shifts. They've been inundated with patients. Right now, Elmhurst Hospital truly is ground zero.
Elmhurst Hospital is in Queens, an ethnically diverse borough made up mostly of working-class immigrants. More people have died here than at any other area of New York City. Health insurance is a luxury many here don't have. Elmhurst is a so-called safety net hospital that won't deny services to anybody, even if they can't pay. But it simply can't keep up with demand. Perhaps most ominous of all is the apex in the surge of sick people needing hospitalization isn't supposed to hit for at least another 2 weeks. There's a healthcare crisis, with the number of New Yorkers infected with coronavirus increasing by the thousands every day. It's not a matter of if hospitals here reach a breaking point, it's a matter of when. And based on what we're seeing here at Elmhurst Hospital, that breaking point might be now. Gabriel Zondo, Al Jazeera, New York.
Marcus Plescia is the Chief Medical Officer at the Association of State and Territorial Health Officials. He explains America's approach to health care as affecting its pandemic response.
The United States has a public health system that is based on the activities and jurisdiction of state governments. And so that's what you're seeing fall into place now. And I think that system has worked well in the past. And I think that as we watch, state governments are stepping up. They have the capacity, they have the expertise to do what's necessary to intervene with this situation. At the same time, they're working closely with the federal government, and that's what's going to need to happen going forward. And frankly, that has been happening so far, and that's a good thing. The issue that we're having with protective equipment for health professionals is a major problem, and we have to overcome that. We're doing everything we can in the United States to increase manufacturing of this equipment. We do have a strategic national stockpile. We have a supply of various medical equipment that's kept in reserve for a situation like that. That stockpile has now been opened up and it's being disseminated out to the places that are the most in need. So there is the potential for some increase equipment in those areas, but we're really counting on more supplies to come in from manufacturers and other sources. I mean, this is probably the greatest thing facing us.
Still ahead on Al Jazeera, the struggle to keep